ঠিক আছে? So students, just I have told you briefly about the reflexes in the previous video. Now I will show you how to do the reflexes, different reflexes. So first let us go to the superficial reflexes. So number one is the conjunctival reflex. Okay, so one thing you remember, in clinics you have to stand by the right side of the subject. Okay, so suppose here because I have done in a bed, that's why you can make the subject sit or accordingly. Okay, because I have mentioned you before it reach the our consciousness. Okay, so accordingly you have to do. Now I will explain what that consciousness means. So conjunctival reflex, that means if someone touches our conjunctiva, then our eye blinks. Okay, so here I have to explain the subject details, that I am going to do an experiment, one examination. I will not harm you, and if you allow me, then I will proceed. That consent should be taken first, and then you have to explain the subject that you have to tell him or her to look far away, to fix his or her gaze in the far point, and say look upward, so that conjunctiva is exposed. Our eyelashes doesn't hamper our experiment. Okay, Mani, sida toka sun, sida toka. Tumi, oh hey, Haricha. Then we cannot go from front. If we go in front of front, that is before we touch the conjunctiva, the subject will see, and he or she will never allow us to touch. That is our protective reflex. So we have to approach from behind. Okay, that is the before it reaches the level of consciousness. Here, so I will proceed just say, just from laterally. মানে তুমি ওপৰৰ ফালে সেইফালে চোৱা, দূৰত চোৱা, ওপৰত চোৱা. And I will just try to touch the conjunctiva. Okay, here I am not touching because these cottons are not sterile. Okay, it may get infected. Okay, so like that you have to do simultaneously in the both eyes. Be comfortable in your position and do accordingly. So suppose you are doing a left eye, so it no need that you have to approach by the left hand, or you can just approach by the right hand like this also. Okay, or if you can, then you can approach by left hand like this. That means before we touch the conjunctiva, the subject should not see the cotton, piece of cotton. Okay, so that is the conjunctival reflex. And what we will notice here, blinking of the eyes. Then corneal reflex is also the same thing. Okay, so what you should not touch the cornea. Actually, we will touch the limbus. Limbus means it is the junction between conjunctiva and the cornea. Okay, so we will touch the limbus, and in that case also we have to explain the subject what we are going to do, and we have to take the consent. After then only we can do the experiment. If anyone denies that no I am not allowed, then you cannot do. Okay, so suppose I have explained her everything, that I am going to do one small procedure, it will not harm her. Okay, after that I will proceed. How I will proceed? I am standing here right side. She may sit in the bed, or if it is say position is in supine position, suppose one subject cannot lie down, then also we can approach. Okay, but we have to approach from behind, just like conjunctival reflexes. Here, say from this side we have to go, and we have to instruct her to look straight and fix her gaze in the far point and a bit up. Okay, look upward and a bit distance. Mani, তুমি ওপৰলৈ চোৱা, দূৰলৈ. Okay, like that. And just from the side, so that this cotton doesn't comes in her field of vision, we have to touch the limbus. Okay, just you have to do in the opposite eye also. Then you will see the blinking of the eyes. Okay, these are the two conjunctival and corneal reflexes. Superficial reflex that we do in the eyes. You never miss any point. Okay, I have explained. If anything remains, please remind me. Definitely I will explain you. Then third superficial reflex is the abdominal reflex. Here, suppose in sitting position, abdominal reflex doesn't have any meaning. So exposure. The abdomen should be exposed. Okay, and that you have to take the consent that in every procedure you have to take the consent of the subject. Okay, and we have to expose the abdomen. Okay, good hobo pare moi expose kora nai amar mane basic good hoy. Then you have to use, this is the Fiddler Hammer. Okay, so the sharp end of the Fiddler Hammer or a key you can use. This sharp point, first you make it sure whether it is too sharp. Okay, if it is too sharp, it may injure the skin. Better you should not use it. And a blunt key or any type blunt pointed metallic object you can use. Okay, just how you will do. So this is the umbilicus. Okay, just like that. We have to sketch it. Like that, we have to sketch it. Okay, in one side, then simultaneously in the other side. And what we will see? We will see the contraction of the abdominal muscle. Okay, so regarding that, in say adult, I will show you once in a small video. Okay, that is my promise. And fourth one is the chemistry reflex. Already I told about that. I think now no need to explain it. Then the most important reflex is the ankle plantar reflex. Okay, so here you cannot miss plantar reflex. Everyone you have to know it. So same, we will use this sharp point, this pointed end of the Fiddler Hammer, or we can use a material just whatever I have told about the abdominal reflex, like that, because we can harm. Here, one thing we have to first ask the subject whether he or she is having any ankle joint pain or stiffness of joint or pain of any toes. And with this flexibility or movement of the toes, we have to check it. And this plantar reflex, you cannot do in sitting position. If I sit, then plantar, that is, before we touch, our consciousness will get it. So we cannot do in sitting position or standing position. Standing position, so there is no question. We have to do in lying down position. Then what you have to do, just I have told what you have to ask her, any pain, then we have to see the flexibility or movement of the joints, whether any pain in the joints, we have to see that. Then we have to take the, suppose this striker, then we have to just just with this three finger, this is the medial malleolus and lateral malleolus, we have to hold it. Then from this lateral aspect, just this is the sole lateral aspect. Here, from here, we will just give strike. See, is very sensitive. That's why. Okay, like this. But you have to strike it. Say, now I will show just with the finger. Say from here up to the base of the second toe. Then what we will see? We will see the flexion of the toes, flexion, adduction, and plantar flexion of the ankle joint. Okay, that is called the flexor response. Okay, just opposite, if you get, that is the abduction of the toes and dorsiflexion or extension of the ankle joint. That is called extensor plantar reflexes. And extensor plantar reflex we get in upper motor neuron type of lesson. Okay, or here you have to know one that is probably is covered in theory, Babinski sign. So before 18 months, a baby, the pyramidal tract doesn't get myelinized, and in that case, so it seems as a pyramidal tract lesion. So in that case, in babies, we usually get the extensor reflex, and that is called Babinski sign. Okay, so thank you for watching it, and deep reflexes separately in one video I will explain you. Thank you.